Hi guys, I am Lydia Sorrells, and I'm going to be presenting on antibiotic-resistant bacterial infections, and I'll be focusing on Mrsa, Visa, and Vrsa. So Mrsa, Visa, and Vrsa are our three types of staph infections. So staph infection is a common name for an infection caused by Staphylococcus aureus, which is a, well, here's a cool thing. The Greek name in Latin is derived from the words for golden grapes, because that's what it looks like under an electron microscope, which I thought was cool. Anyway, it's a gram-positive bacteria, and it is spherical. It's about 1 micrometer in diameter, and it has multiple virulence factors, which make it very virulent for human beings, including surface proteins, which promote adherence to human tissues. And it also has specific inhibitors of phagocytosis that just prevent your body's natural immune response. And it also has toxins, which are just damaging to your tissues and cause many different types of diseases. So a staph infection comes in two general types. You can either have a nosocomial infection or community-associated. And you get these through direct contact. So a nosocomial infection is healthcare associated. So that would be like if your doctor doesn't properly clean his like surgical instruments or something else which is going to be touching an open wound. It can also be transmitted through contaminated hands. So if some healthcare worker doesn't properly clean their hands before touching an open wound. And so this is why people who have even implants, such as heart valves or artificial joints, can be susceptible because the staph bacteria will just congregate on that foreign object in your body, and it can become infectious. So it mostly causes superficial skin infections, like this cutaneous abscess, which just looks horrible. But it can also cause more serious infections if you have other underlying illnesses going on. So the incubation period of a staph infection is indefinite because staph just lives on your body, which I forgot to mention. So staph, usually it just lives all over your skin, and especially in your nose and in your mucous membrane. So it's everywhere inside you, especially your respiratory GI tract, which is why it's difficult to say like, oh, you were infected this day and you've been infected for 7 days, because it just lives on your body. And it causes, first of all, inflammation, so just your usual immune response to any sort of foreign invader. Like when you get a cut, you get the pain, swelling, heat, and redness associated. And you can kind of see over in this chart up here with all these lovely skin problems like boils, cellulitis, and pedigo, which is kind of like the crusting of the skin. And you can even get infected hair follicles. So it's just all associated with your skin. But it can also cause more serious infections if you are one of those at-risk people, like if you're immunocompromised or if you have an underlying health condition like cancer or diabetes. And anyone is at risk for a staph infection, but especially people who are going to be in close physical contact with each other. So it's a big problem among athletes. Like if you're a wrestler and you have an abrasion on your body that's kind of oozing blood or pus or something, and then you wrestle with somebody, then you're going to be passing on that bacteria to the person with whom you are wrestling. And injecting drug users are actually 16 times more likely to be infected, because if they don't properly clean the needles, or just because they are constantly opening up wounds in their body and they might not be properly cleaning it, or it's just, there you go, you're inviting bacteria into your body with that open wound. So you especially see it among them. So I had mentioned at the beginning that there are 3 different types: Mrsa, Vrsa, and Vrsa. So how do we distinguish among them? The classification depends on drug resistance. So that's why these staph infections are so dangerous, because they happen to be resistant to the drugs that we use to treat them. And so it depends on the minimum inhibitory concentration of the drug. So you would look at, so the way that you would diagnose is your doctor would look at the abscess on your skin, and he would take a sample of it, send it into a lab, and then the lab would expose that sample to various drugs. So Mrsa is whenever that sample is resistant to methicillin, and you can either have CA Mrsa or HA Mrsa. So CA is community associated, HA is healthcare associated. So community associated is actually a rising problem because people are just getting it in their daily lives, and it's a little bit harder to diagnose and treat because as you saw, let's see, on this other slide, the abscess on your back, that kind of looks like a fiddleback bite. So sometimes people will get a staph infection and they'll just assume that it's just a spider bite and they won't get treatment for it. And if they don't get treatment for it, then it's obviously more likely to develop more serious infections. And then there's Vrsa and Vrsa. And these are staph infections which are resistant to the antibiotic vancomycin. And they're both resistant to it, but there's a distinction even between them, so I'll get to that in a second. Mrsa is methicillin-resistant staph. So this is staph that has developed multi-drug resistant to beta-lactam antibiotics, and it develops this just through natural selection and horizontal gene transfer. So whenever staph is resistant to methicillin, the mechanism is usually this extra chromosomal genetic element called MECA. I don't know if it's if you say MECA or something, or MECA, but whenever that gene is turned on, then the staph is able to resist methicillin, and then you can't treat it with that anymore. And that's actually very problematic because we're still having problems with Mrsa more and more. Okay, and then there's also Vrsa and Vrsa. So these are both staph infections that have resistance to vancomycin. And Vrsa is like intermediate, that's what the I stands for. Vrsa is just resistant in general. So Vrsa is slightly less resistant than Vrsa. But both of these are treatable with FDA-approved drugs as of October 2010, so we don't worry about this one as much anymore. And then some history. So these are, so you can kind of trace it back to when Alexander Fleming discovered that penicillin can kill bacteria in 1928 because of his very messy desk. And then in just in the years following, we had more penicillin-derived antibiotics. So penicillin works by inhibiting cell wall synthesis of the bacteria. And so Mrsa and Vrsa and Vrsa all have developed ways to protect their cell walls. I think one of the ways is through just having a capsid or a capsule on the bacteria itself. And then, so throughout the second half of the 20th century, we saw more and more outbreaks of antibiotic-resistant staph infections. And in the mid-2000s, researchers started to get worried because we started seeing community-associated Mrsa, and especially within healthcare facilities. So then they started having to distinguish between, okay, this is Mrsa, but this person, it's community-associated, but now he's in a healthcare facility, so we have to treat it in different ways. And then in October 2010, Vrsa and Vrsa were found to be susceptible to FDA-approved drugs, so that's a positive thing. However, one study has found that 4.6% of patients in maternity wards and I think NICUs have Mrsa. Just if you just swab their noses, then they just have it. And so this is a sign that Mrsa is becoming a growing problem because more and more people who shouldn't be having it have it. And as I mentioned earlier, drug users, intravenous drug users, are 16 times more likely to be infected. And so researchers noticed, especially from 2007 to 2012, I think, that there has been a 2005 to 2016, that's what it is on this table right here. There's just a rise, an increase in Mrsa patients, especially among people who inject drugs. And so one concern is that the opioid epidemic, people who inject themselves with opioid drugs, is contributing to antibiotic resistance. So that's a big problem. So we need to address two things at once. All right, so treatment and prevention. So treatment and management of staph infections can be kind of complicated because you have to consider the different vulnerabilities that someone might have. So if you're a cancer patient or a diabetic, then there are different ways that you would treat it. Usually, the way that you can treat a staph infection is just by removing the infected object, because a lot of these are associated with like heart valves or implants, and so you might need to remove it or just clean that, or even catheters. Like that's an easy fix. And then the way that you prevent transmission, this is just the biggest push that the CDC has been having, is just wash hands, clean your surfaces, don't share items such as razors or towels. And especially in healthcare facilities, everyone needs to be washing their hands. So that's all that I have for antibiotic-resistant staph infections. Have a great day, guys.